The Indian Council of Medical Research has confirmed 2 cases of human metapneumovirus or Hmpv in Karnataka. This is the same virus linked to a surge in respiratory illnesses reported in China. Both cases were identified during routine surveillance conducted by ICMR to monitor respiratory viral pathogens across the country. The first case is an 8-month-old male infant admitted to Baptist Hospital, Bangalore, and is currently recovering. The second case involves a 3-month-old female infant admitted to the same hospital. Notably, neither of the infants has a history of international travel. Hmpv, which primarily affects children, is detected in approximately 0.7% of flu cases globally. Amid the rising cases of Hmpv in China, the Indian government has intensified its monitoring efforts. States, including Delhi, Maharashtra, and Telangana, have issued guidelines to bolster preparedness for potential health challenges associated with Hmpv and other respiratory viruses. Symptoms of Hmpv infection closely resemble those of COVID-19, underscoring the need for vigilance and early detection. A new virus has raised concerns in China. The infections caused by human metapneumovirus have been reported in the country as the administration steps up screening, detection, and isolation protocols to deal with unknown pathogens. Videos shared on social media showed an alarming situation in hospitals with waiting rooms overcrowded and patients wearing masks. Some videos emerged where patients were seen coughing. The looming threat of another pandemic 5 years after COVID-19 brought life to a standstill and has created panic online. China has reported rising cases of Hmpv, especially among those under 14 in northern provinces, Reuters reported, citing officials. Earlier on December 27th, China's Disease Control Authority had said that it was piloting a monitoring system for pneumonia of unknown origin, with cases of some respiratory diseases expected to rise through the winter. An official statement indicated that data for acute respiratory diseases showed an increase in overall infections during the week of December 16th to 22nd, as reported by Reuters. An official stated at a news conference that China is expected to face various respiratory infections during the winter and spring. As per a Reuters report, he added that the total number of cases this year is expected to be lower than last year's, although the official did not provide any further details. The common symptoms of Hmpv are cough, fever, nasal congestion, and shortness of breath. In addition to this, other clinical symptoms of the infection may aggravate and lead to problems like bronchitis or pneumonia. The incubation period for the infection is typically 3 to 6 days, meaning individuals may begin to experience symptoms within this time frame after exposure. The duration of illness can vary depending on the severity of the infection. Like COVID-19, Hmpv is spread through respiratory droplets when an infected person coughs or sneezes. It can also be transmitted by touching surfaces contaminated with the virus. Now, should India be worried? Currently, no reports of Hmpv has been reported in India or any other countries except for China. Also, the severity of the virus is not known in China. However, it is recommended to follow basic precautions to prevent the spread of infection, such as washing hands with soap, avoiding touching your face with unwashed hands, maintaining distance from infected people, isolating if you have symptoms, covering your mouth and nose when sneezing, not sharing cups and utensils, and staying home when unwell.